So white blood cells, their official word is called leukocytes. The leuko part just means white. And I'm like, so a leukocyte just means a white cell or a white blood cell. There is not that many of them in our red blood cells, which is why it becomes a little hunt and find for when Deke tries to find some of these for lab exams. They make up less than 1% of the total volume of our blood. Most of our blood is plasma. Most of our blood is red blood cells. There are somewhere between 4,800 and 10,800, I wouldn't ask you specific numbers, of white blood cells per microliter of blood. Just kind of on average. Main job of white blood cells, and I'm like, they're there for defense. And I'm like, against some type of disease, whether it's viruses, whether it's bacteria, whether it's just something got in that shouldn't, and I'm like, they function in defense. Now, they can move if they want to. They move in an amoeboid-like fashion. If anyone remembers at some point in a bio class what an amoeba does or how it moves, it kind of oozes along a little bit. And I'm like, these white blood cells can ooze along and they can move wherever they need to be. If there is an infection of a parasite, a bacteria, a virus, whatever it is, they can ooze and get their way there. Now, how they know there's something going on, they follow chemicals. It's called chemotaxis. They follow a trail of chemicals. So bacteria, viruses, parasites, anything like that, fungus, and I'm like, well, there's a little chemical trail, and white blood cells find it, and they kind of ooze along until eventually they can figure out where the infection is. Now, if there is some foreign invader in your body, you know, whether you had the flu or you had the cold at some point this winter, if you have some type of infection, something happening in your body, your white blood cell count is going to go higher. Again, if we're mounting a defense, we need backup. And so your white blood cell count will go over 11,000 per millimeters cubed, which is the same thing as saying a microliter. And I'm like, so your normal white blood cell count is about this many. However, if we look in our blood and you're fighting some type of infection, it's going to go a lot higher. It's also one of the reasons if you go to the doctor and you're like, I don't feel very good, they want to test your blood because there's lots of things you can find out in your blood. That's why we care about it so much. One of the things they can be like, oh, well, they've got a huge number of white blood cells, way more than normal. There's probably some infection of some sort going on, and they can start to kind of clue them in on what's going on. Now, our white blood cells are split into two categories. If they have granules and if they don't have granules, we're called granulocytes and agranulocytes. These are the things in the cytoplasm, you know, and these are the ones that'll pick up stains, and we can see all these grainy little things in the cytoplasm. Now, our three granulocytes are our neutrophils, the eosinophils, and our basophils. And our agranulocytes just means they don't have any visible granules in their cytoplasm, which is our lymphocytes and our monocytes. And yes, the order of abundance of our white blood cells in our blood, I mentioned this in lab, is that never let monkeys eat bananas. So your neutrophils, your lymphocytes, the monocytes, the eosinophils, and the basophils. And which ones would you have to know under a microscope for a lab? The first two, and I'm like neutrophils and lymphocytes, and I'm like, because they are the most common, maybe yes in a microscope. I'm like, everything else, they are so, I'm like, infrequent. You could spend hours trying to find one of these on a blood smear. Now, starting with our granulocytes, starting with our neutrophils. Yes, and I'm like, these are the ones, if we look at them, they have these multi-lobe nuclei. They look anything but neutral. Now, they have proteins called defensins, which, yes, and I'm like, that's part of their name. I'm like, they're some of our defense white blood cells. But their main job is phagocytizing bacteria. Now, any guess what a phagocyte or what the phage part means? It eats. These are eating cells. If you have a bacterial infection, it is these particular bacteria that are going to go in and try to eat up all those bacteria and try to get rid of them. The next granulocyte are our eosinophils. Again, and I'm like, they're granules. The granules in the cytoplasm like to pick up the pink stain. Again, some call it red. It looks pink. Their main job is if you have some type of parasitic worm infection, you know, you ate raw something or other, and you got some type of parasitic worm somewhere in your body, it's these eosinophils that are there to go and digest and try to get rid of those parasitic worms. Mostly because the granules that they have that stay nice, pretty pink their granules are lysosome-like, which means, I'm like, lysosomes, they have digestive enzymes. These granules have digestive enzymes to digest parasitic worms. They play a minor role in allergies and asthma. If you've got, I'm like, we'll get into the big one for the next one, but I'm like, they can trigger some types of allergic reactions and asthma, and I'm like, as well. But most of your allergic reaction symptoms is usually from your basophils, the last of the granulocytes. Again, their granules pick up the dark purple stain, so you can't even see the nucleus. There is a bilobed nucleus in there, you just can't even see it. It's these particular white blood cells that release histamine. It's an inflammatory chemical that acts as a vasodilator to attract more white blood cells to some type of inflamed area. And so this is generally what's happening during some type of allergic reaction. You're exposed to something your body doesn't like, and I'm like, and again, anytime your body's exposed to something it doesn't like, it wants to get rid of it, so it wants to get more white blood cells to that protected area to try to get rid of whatever it is, even if it's not something okay that, for most people. It's an inflammatory chemical that does this. Now, if you're having some type of allergic reaction, what do you take? Benadryl. And what is Benadryl? An antihistamine, aka like any type of allergy type of drug, are antihistamines. They're pretty much trying to make those histamines behave and try to counter effect what the histamine is doing. Your white blood cells, the basophils, are releasing these inflammatory histamine chemicals that, yes, causes all the horrible reactions that comes with allergic reactions. We take antihistamine, and it kind of calms it all down, and you don't have those inflammation. So we take antihistamine because of those guys. Now, our agranulocytes just means they don't have the granules in the cytoplasm. The first one we have is lymphocytes. Yes, we find it in lymphoid tissue like lymph nodes and the lymph nodes in the spleen. It's where it gets its name, is where we find it. Very few circulate around in your blood. Again, it's very uncommon to find these in your white blood cell or in your blood itself. But, and I'm like, there's a few. These are the ones that are all about the immune system. So your take-home exam is on, yes, the immune system. And so you're going to start to see lymphocytes, like T lymphocytes and B lymphocytes. They're just two different types of lymphocytes. Just depends on what they're trying to fight against. Again, these are all types of defense cells. T lymphocytes usually are fighting against internal things, say internal pathogens. Viruses like to go inside cells. And so they like to fight against virus-infected cells. They also fight against tumor cells. Yes, and I'm like, we do have our own cells that can fight against tumors. I don't always, sometimes you can't get enough of them and they can't do their job properly, and you end up with a big tumor, but otherwise we do have cells that try to prevent that from happening. B lymphocytes, these are the big ones that make antibodies, and I'm like, against various pathogens. So like if you've had some type of virus, like you've had the chickenpox, how many of you have actually had the chickenpox? Okay, half of you, a little over half of you. Everyone else? Vaccine. Lucky people. And I'm like, now, it just means at some point you were exposed to the chickenpox virus, whether by shot or whether because, a neighbor kid or your brother or sister. And I'm like, you made antibodies against the chickenpox virus. And so if you're exposed to it again, you can fight it off and not get it again. And I'm like, you can thank the B lymphocytes for making those antibodies so that you get the chickenpox once or you get the vaccine once, and it should be enough. And the last of the white blood cells we have are the monocytes. These size-wise are the largest ones. Looking at them, they do have that U-shaped or kidney bean-shaped nuclei. And their main job is that they can leave the blood vessels themselves. They can go into tissue where there may be some type of infection, and they turn into a macrophage. Based on its name, what do you think it means? Large? Eater. And I'm like, these are big eating cells. They are the largest of the white blood cells, and they just turn into a straight eating cell. They go there and try to eat up anything that shouldn't be there, whether it's a virus, whether it's a bacteria, and I'm like, they are just big, huge eating cells. A lot of times if you have a chronic infection, you have something that is, a virus that just does not seem to go away, you're going to see a lot of these monocytes in action trying to get rid of them. They can also help trigger those lymphocytes to mount some type of immune response. They can be like, hey, we've got these foreign things, whether it's a virus or not. They can go tell those lymphocytes, like, we should make antibodies against it so we don't get this again. So they chat with each other. Now, some white blood cell disorders, leukopenia. Penia, the word itself means lacking. And so you have less white blood cells than you normally should. Usually this is a drug-induced thing. And I'm like, a lot of times, it's more common to have too many white blood cells than too little. Reasons why you may have some type of drug that decreases your white blood cell count. If you have a cancer where you're making too many white blood cells, you may not want that many. And that comes down to leukemia. Leukemia is an overproduction of white blood cells. Most people are like, well, isn't that good if you get like a bigger army? It's good to have lots of white blood cells when needed. However, in leukemia, the bone marrows are the different parts of our body. I'm like, not just bone marrow. I'm like, we'll start to turn out white blood cells, and they turn them out so fast, they don't make them correctly. It's like if you're trying to do too many things, you just kind of do a sloppy job at it. That's what's happening in leukemia, is you overproduce too many abnormal white blood cells. And so they're not up to par. They can't mount any type of defense. They more get in the way. And I'm like, they will actually start to fill your red bone marrow. And so your red bone marrow is turning out lots of red blood cells as well. It now can no longer churn out enough red blood cells because it's so packed with these white blood cells, aren't doing any good, that you can end up with anemia. Now, does anyone know what anemia is? Or what a side effect of anemia is? I was going to say, you're tired all the time. You don't have enough red blood cells would find oxygen. And so you end up being really tired, really exhausted. You don't have enough red blood cells. And because some of it, they can fill up the bone marrow so much that it can actually start bursting different blood vessels, and you can have internal bleeding in your bones as well. That's not good. Usually, leukemia, if untreated, will cause death because of internal bleeding, because it's bursting certain blood vessels, or you have an overwhelming infection. You're not making any normal white blood cells. You're just making large amounts of abnormal white blood cells that can't treat any type of infection. Right now, their best treatments is radiation, various types of drugs to try to control or slow down the making of white blood cells, which, yes, if you take enough of them, could lead to leukopenia, which is always the bad thing. Otherwise, they're looking at stem cell transplants. Let's try to remove those cells that are dividing like crazy, making bad white blood cells, and let's put in cells that are going to make correct, normal white blood cells. And I'm like, and so you can even get on a stem cell transplant, list. And I'm like, and you can get called and donate stem cells. Now, mononucleosis, aka mono. Anyone had it before? How many? I'll say some of you. I have not, which is okay. And I'm like, if you've ever had mono, it is a white blood cell disease. It's caused by a virus called the Epstein-Barr virus, and you end up with a high number of atypical granulocytes. These are your basic lymphocytes and your monocytes. So you end up with a large number of these particular white blood cells. Your biggest symptoms, you are tired. It's a big symptom. And you're achy, sore throat that doesn't want to go away, and you have a low-grade fever for weeks, if not months. Now, one of the bad things about mono is because of all these extra white blood cells, they have to go somewhere. They all go to the spleen to die. It's like a white blood cell graveyard, and you end up with a really large spleen. Now, just over on this side. And I'm like, really a large spleen. Now, that can become a problem because there's a really big artery that goes through the spleen. Now, this is why they say, and I'm like, don't do sports if you have mono. Because if you have this really enlarged spleen and you fall wrong, get kicked wrong, whatever sport it is, who knows how dangerous it is, and I'm like, that spleen could rupture. What's going to happen to the artery that's in it? It will burst. How long do you think you'll live? A few seconds. And I'm like, and that's it. And I'm like, they say, don't do sports if you have mono because of that enlarged spleen, and it could cause death. And how many high school kids listen to that? none. And I'm like, it does happen. It occasionally makes the news. Eventually, your immune system will kick in and it will go away, but it could take weeks. I'm not going to get through platelets, so we're just going to start right there. I know we didn't get through a ton, but